coronavirus has turned everyday life upside down. We've been talking about this for weeks, from social distancing to self-isolation to self-quarantines, and the mounting fear and anxiety surrounding COVID-19 is overwhelming.
Yes, psychologists say normal to emotional during crisis, but if stress isn't managed, it can affect your mental and physical health. Joining us now via Skype is psychotherapist Dr. Mitcham. Good morning.
Good morning, ladies. How are you?
Doing well.
Good. We're trying to make it through as well.
Exactly.
So this conversation is going to be for everyone. All right. Well, it seems that the coronavirus has changed the way we live, and most Americans and people around the world are being held, it feels like being held hostage by this virus. For many, this is a time of extremely high stress. So how can people manage their anxiety during this unknown and challenging time?
Wow. So that's an excellent question. And there's so much that can be done. So people need to, number one, try to handle the things that they can handle, but acknowledging their emotions is very important. Like you said, it's normal to have stress, but we've never experienced anything like this ever, I think, in this lifetime. So handling the stress by, number one, dealing with the facts and trying to reach out to and listen to known resources like the CDC, in Atlanta, daily updates, connecting with your family, trying not to awfulize. Sometimes we can be so stressed out that anxiety can paralyze us. You know what I'm saying? So we don't want to be paralyzed. So trying to be problem focused and not emotion focused, because if we're only dealing with issues with our emotions, then we can get on this emotional roller coaster. So dealing with the facts, trying to stick with a plan. So there's some level of normalcy. And I know this is very atypical and abnormal, but trying to have some type of routine, not getting overwhelmed with the news. Some people are plugged into the news almost 24/7 when they're awake. And this can actually escalate your stress. I can imagine you all doing the news. You have to be in the newsroom and you're getting updates probably every few minutes. And so you too have to, like you said, unplug from that and do something else that brings you joy. Maybe some relaxation, yoga at home, take breaks, definitely unplug from all of the social media. I think that would be great. I don't know how you all are doing it.
It is a struggle.
It really is. And we talk about it. We check in on each other every single day, because it's one of those situations where we are immersed in it so much. And you really have to think about your mental health during this time. And
exactly.
Anxiety, I feel like I deal with it at times. I know you've dealt with it. And it's just one of those things that you really do have to look at and be like, okay, what can I do to kind of just heal from this, take a step back?
Yeah. Now, everyone has a different way with dealing with a crisis. Many are fearful, some nervous, you have anxiety, anxious. What are some of the other normal reactions or emotions that people may be experiencing?
Some people might just kind of go numb. Some people might be angry. Some people might get kind of hyperactive. They're just trying to do something, because people want to control what they can control. So it's important to try to control those things which you can control. We can't control our schedule. A lot of people are nervous about food, and about the toilet paper.
Yes.
A lot of people couldn't find toilet paper, but we are going to have food. The stores are being restocked from what I understand, and toilet paper. So try not to worry about food. I know a lot of restaurants are setting up food for children, especially, kids are out of school now for the next few weeks. So there's some things and resources that can help to alleviate some of the stress. But again, if there's some routine that you have in the house and other things you can do, because some people do react. Some people already have a diagnosis of anxiety. They may be taking medication. So it's important for those people who feel that their stress is getting out of control after they've tried their own remedies and exercise and things like that. They may have to keep in contact with their doctor. A lot of doctors are doing teletherapy. They're doing telemedicine. So you never know unless you reach out to your doctor, your therapist, to see if they have teletherapy or telemedicine, because telehealth is really big right now. And I think this is really testing the world on how we use technology. There are many resources out there. So getting plugged in And sometimes just demystifying the process, getting the knowledge, understanding the resources, reaching out to family, staying connected is very important. And not just with the news, but with the people that you love, the people that you care about. That's very, very important.
Mm-hmm.
And what are some coping strategies to help control all of this stress and anxiety?
Some of the coping is talking about it, but you want to make sure that you're not talking to other people who have very, very high stress levels. There's always that friend or relative that after you talk to them, your stress goes like way up here.
Yes.
That's probably not the person you want to stay with on the phone a long time. So make sure that you are very, um, picky and strict about who you're speaking to, because you want to make sure that someone else's anxiety and stress is not escalating yours. So that's one thing, making sure you are choosing and you're intentional about your interactions, talking to your family, being honest about your feelings as well. Some people say, well, be strong. Well, what about if you have children? Children are
Right.
stressed out, and we wonder, some people are asking me, well, how do I talk to my children? Let them know that their feelings are real. Talk about it and admit that this is a scary time. So talk about it, reach out to family, reach out to your loved ones, stay connected. Again, exercise, do some breathing activities. A lot of people practice yoga, but even if you're not a yoga expert, you don't have to be. Practicing mindfulness, you can actually Google or go on YouTube and put in guided imagery. And I think that's very important to do some guided imagery, breathing activities to just calm. Just as I'm speaking, that's how calm these videos are. They have music, they might have the ocean, and you do the deep breathing exercises with the YouTube video. They're apps. There are many apps right now that people can actually just download to help them have that time to themselves. And you need your me time too, and quiet space to process all of this. Also dig into and access your spiritual or religious beliefs and meditate. That's very important. And try to be calm and model that and demonstrate that. Because when everybody's running around being stressed out, it's going to escalate everybody's anxiety.
Yeah, we've been feeling that.
Yes, we really have been.
All right, we're going to continue this conversation with Dr. Michelle right after this break. Stay with us.
Welcome back with Dr. Michelle Mitcham, talking about fear and anxiety during this coronavirus outbreak. And, a lot of people have events that have been pushed back and all these things. I turned 30 on Monday, and I feel like everything has just, you're already dealing with the stress of turning, going into another decade. And then you're dealing with that on top of everything that's going on. What suggestions do you have to help people who are already going through that one stress and how to, just cope with all of that?
Well, that's an excellent question, because they're everyday life stressors, and then turning the big 3-0. Some people are turning the big 4-0, and you start taking stock in your life. So you have your everyday stressors on top of this. And so I think that, again, if you try to put things in perspective, which is hard, maybe some people like to journal and write about it. Some people like to walk and put on their music and listen, just to get that mind space clear. I think that being realistic and trying to put things in perspective is very important, because it's only like, how do you eat an elephant? One bite at a time, right? So you probably have your list of things. For example, you're thinking about, okay, I just turned 30, or I have some home improvements, or I need a new roof. So on top of all of that, again, I like the analogy. Sometimes you feel like you're standing under Niagara Falls trying to catch all the water with a teacup in everyday life. So now with the crisis, what do you do? I think this is a great time to reflect, to look inward, to appreciate family, to practice gratitude, to really meditate on what's important, maybe exercise again, and just try to put things in perspective, because this is not going to go on forever. We don't know how long, but if we can maybe help others, like I said, reach out and get the facts. Don't overwhelm yourself with the things that you can't control. But write it out, make a list. I know some people make lists. You can do it on your phone,
Yeah.
in your notes section, write on your telephone, or write it out. But make a plan. Try to have a plan, I guess, each day, because day by day, this is just unfolding. We don't know what's going to happen tomorrow, right? But we do have food, we do have resources to tap into. So try to control those things that you can, and try to access your inner, that inner voice, your inner spirituality, and have that mind, body, spirit balance to the extent that you can. So again, control those things that you can, and try to let go of the rest. I think earlier you said, right, you have to, whatever, if you pray about it. For those that don't pray, whatever your higher power is to help you get through this, because we will get through this together. We are strong, we're resourceful, and so try to get your support system together, and just focus on what you can and not awfulize. Because, sometimes we think about, oh, what am I going to do? What am I going to do? Try not to be irrational, but be rational and just stick with the facts and not blow things out of perspective and limit those people that are fear mongers, that are taking things to another level and maybe spreading information that's not true. Try to stick with the facts.
I needed to hear that one.
Yeah, I know a lot of people, the million-dollar question, everyone wants to know, when will this be over? What are some ways we can kind of cope with the unknown and living in this new normal of not gathering in groups of more than 10, or kind of having a distance towards your friends, or not working? Many people are out of work, kids are at home. So some ways to cope with this as we, continue to figure out and try to find an end to this.
That's an excellent question. So creativity is very important right now. This might be the time that you discover new apps. There are people, of course, we know that they said the other day, 364,000 people around the world downloaded Zoom, either on their phones or computers or other, conference calling mechanisms. And so sometimes just using some of the apps, being creative with family, this is kind of like a downtime that you can get connected. Everyone doesn't have children. Some people live alone. So there's a big challenge for those people that live alone. Like, who are you interacting with? So you might have to go to the computer. Again, this is a great time to retool and learn something. Retool with your family. Do something together. If you do have children, work on some projects together. Talk about it. Again, don't not discuss the issue, because if children are fearful, let them know that you're fearful too, but everything's going to be okay. So we have to have hope, right? When there's no proof out there, we have to believe and have hope. And so being hopeful and trying to use all the resources we can. Again, nature, technology, family, using apps. And it's just amazing how many apps there are. Again, I think technology is a way to stay connected. There's a million things you can do. There are videos. Again, you can access the any of the videos for calming yourself. Guided imagery. That's always important. And for those who haven't tried it and want, just try it. Try something new. And that thing, I think, try something new, because this is we've never dealt with this before. So try new resources. Try new things. Some people go to the gym. We know that the gyms are now shut down, right? So maybe you turn a part of your garage into exercise, get your weights, walk around the house, do some lunges, do some jumping jacks, like some of the old fashioned, just, floor exercises, get your yoga mat and be creative. And there are videos and apps that you can exercise with. And I think that helps to reduce a lot of the stress. Even if you're not cognizant of the stress you're feeling, we all have to kind of let go, breathe, and focus on those things we can. And this is time to invest in your self-care plan. And I think self-care plan for everyone is different. A self-care plan for me might be that I meditate, I might have my, smoothie or a cup of coffee, read a book, I might do some journaling, talk to family, or watch a movie, watch some comedy. I'm not saying be a couch potato, but try to do different things and be creative while you're in the house. Maybe this is time for a do-it-yourself project. DIY things are really, really, really big right now. So maybe if you're a painter, try to paint something, but try to plug into your creativity and figure out other ways to do things. and just do things differently. And that's hard sometimes when you get into your own pattern. This is causing us and forcing us to think outside of the box. But we can do it, with risk and courage. We can redefine the possibilities in our life. So we have to be brave, we have to be courageous, and you have to have courageous conversations with yourself and others to get through this. This is a difficult time, and to acknowledge that and to own that it is a gift to yourself, and to just have gratitude that we're here, and just stay away from not stay away from everyone, but practice the social distancing as much as possible, and follow. I know that I saw the news about the spring breakers and stuff, and I was worried about the kids out there on the beach. But you definitely just have to be careful and try to follow the precautions to the best of your ability.
I really needed that. I feel like so many of us need it out there. And thank you so much for joining us today, Dr. Mitcham.
Okay, thank you so much for having me. You all have a great day, and be safe and be calm.
We will.
Thank you so much.
Try to breathe.
We feel a lot better now that we've spoken to you.
Yes, we do.
Thank you so much.
Thank you. Bye-bye.
Bye.
Bye.